Now, a medical organisation has been warning Labour will struggle to meet its pledge to end the 8 a.m. scramble for GP appointments without increasing costs. The Doctors Association UK has been saying at least £35 more per patient per year is needed to match funding levels from a decade ago. Now, during the election campaign, the now Health Secretary, Wes Streeting, did say his party would make it easier to book appointments. Well, joining me now live on LBC News is co-chair of the Keep Our NHS Public campaign and also retired consultant paediatrician, Dr. Tony O'Sullivan. Thanks for your time this afternoon, Doctor. I mean, firstly, your reaction to this Doctors Association UK claim, £35 more per patient per year. That seems like an awful lot of money.
Well, I'm not sure if it does seem like an awful lot of money. Really, to me, it's the amount of money that GPs get has indeed fallen by a huge proportion over the last 5 or 6 years. GP primary care gets 20% less funding than it did in 2008, at a time when now GPs are responsible on average for 300 more patients over the last 5 years, and there are 1,700 fewer GPs since 2015. And at that time, you might remember Jeremy Hunt promised 5,000 more GPs. In fact, there are fewer over that time. And the GP service is actually the cornerstone of the NHS. It's the essential part of the NHS where every single person has the right to see a GP, to either have an assessment and treatment and advice, or for the GP to recommend referral on to the right appointment if that is necessary, whether it's mental health or hospital treatment. The amount of money per day is something like 50p a day, or that the GPs would be getting to be looking after the population of families and individuals, whatever their need. And that includes people who may, on the one hand, from one year to the other, hardly need their GP for if they're young and healthy. And on the other hand, there may be incredibly complex needs and people needing to see their GP virtually every week, and they get the same amount of money. So there is a real crisis in primary care. There's been a real failure of past governments to address the need, and they've neglected primary care in a similar blasé way to the way they've neglected hospital care and mental health. They've allowed the levels of funding resources to dwindle. GPs are under so much pressure now that so many of them, a frightening number, are looking for early retirement or leaving the NHS. There's an incredible amount of mental health distress amongst GPs, as in other parts of the NHS, like nurses as well. But the NHS relies on sections of it working closely together. I used to work as a paediatrician I have the privilege to work with disabled children and their families. And that was a really good example of ongoing needs where GPs needed to work with mental health, with A&Es, with hospital specialties, with schools. And if you have one part of a whole system breaking down, that chain is broken, and the excellent care that people need and deserve just starts to falter. And GPs taking action at the moment are saying, you've got to listen to us. You've got to realise that primary care, the first port of call for the population when they need health advice, is in real danger. And we need to reverse some of the trends that have gone on to say trained doctors or trained nurses are too expensive, and we'll replace them with physician associates for doctors or nurse associates for nurses, where there's far less training and it cheapens the workforce, but it actually undermines the skill level. So I'm not arguing against those. Support people in primary care, that they should be additional to GPs, trained GPs, experienced nurses, not replacing them.
But Doctor, I mean, I take your point, but of course, where is the money going to come from? You know, GPs have been asking for more money. They've been saying, and you mentioned about the mental health impact on doctors and people right the way across the health service. Presumably, that's also not been helped by the pandemic that we've recently lived through. But the Labour government have come in and said, essentially, there is no money. Where does the money come from? How do we end this?
I think the argument needs to be put to the Labour government and get them to listen that the country cannot afford not to have a functioning health service. It cannot afford to allow the numbers of people out of work, of working age, rise 800,000 since COVID, and it's now at 3 million. So there's 3 million people who could be contributing to the country who are out of work because of ill health, waiting on waiting lists, waiting for treatment, etc. So there's a pure economic argument that it's crazy. It's absolutely shooting yourself in the foot as a country not to have a functioning health system. The second point is that when a government says there's no money, they are expressing a political choice. And the argument that the NHS is a bottomless pit, for example, is wrong. We have far less funding than France or Germany. And if you use France as a comparator, if we had been funded at the same level of the French health system over the last 10 years, we would have been having 35 to 40 billion pounds in NHS funding every single year. And that level of underfunding is why every area of the NHS, including GPs and including GP buildings and health centres, they're crumbling in terms of mental health, in terms of morale, in terms of the numbers of people in the workforce, and in terms of the buildings themselves. So,
of course, Doctor, I mean, in terms of how we actually solve this, I mean, the Doctors Association UK saying that £35 more per patient per year. I mean, a prescription is, what, £10 now? There have been suggestions that what if it came out of our own pocket? That £35 a year, some people would be prepared to pay that to keep the NHS going, or do you think that that goes directly against the entire principle of the NHS?
It undermines the fact that the NHS is free at the points that you need it, and yet society as a whole, contributes to the funding of that health service as a kind of collective social insurance by paying taxes and other contributions to public funding, and it's a political choice. Prescriptions are free in Scotland, so it's a political choice to charge. And I return to the point, really, that the NHS has been underfunded compared to comparable nations, 17% below the average health spend for the OECD countries, for example. And as I've just said, £40 billion a year less than if we were at the same level of France. So it's wrong to be saying we've got no money, so let's stop making people pay. That will fuel inequality. It will make people who can't afford to pay go into poverty, or they will avoid going to the doctor at all because they can't afford it. And there are already some stories of people coming to harm because they have run out of, for example, their asthma medication. That there was a young woman 3 or 4 years ago, I think she was 18, who died because she hadn't paid for her asthma renewal of medication, and she died because she didn't have her asthma pump. Inequality is something that has already risen dramatically, and the health service, when it's funded well and when it's funded and operates on the model that we have had since 1948, free at the point of need for the patient, but paid for collectively by society, it's not only the most cost-effective in the world, it's also the most equitable. And I do not want to lose that. And at the front door of that is the GP and the GP team with the GP.
Dr. Tony O'Sullivan, I appreciate your time this afternoon. Co-chair of Keeper NHS Public, retired consultant paediatrician there. Thank you very much for your time this afternoon on LBC News.